several years. Worked with her back when she was on the Kansas City Public School Board, and have worked with her even more in her present position as a council person. And also know how dedicated she is to health issues. So Melissa, take it over.
Wonderful. Thank you so much. And I will have to admit, this is the first time in which I've been afforded an opportunity to talk for 90 minutes. So that is a long time. So I will do a lot of stopping and hopefully we can have some interactive conversations, as I know you probably just don't want to look at a screen and listen to somebody talk for 90 minutes. So I look forward to the opportunity to engage. Today, I've been asked to talk about what it's like to be on the city council, and then talk about the Black Healthcare Coalition as well. I've worked for the Black Healthcare Coalition for probably going on, I think in January it will be 15 years. So it's been quite a wonderful ride. It's a 32-year-old organization here in the greater Kansas City area, and really is the reason why I joined public service, among some other things. But as we began to look at back in 2010, what we were going to be doing to address health inequities, we really reached out to the community. We did a lot of door knocking in what we call low life expectancy areas. And we talked to parents mostly of young children and talk to them about what would it look like for us to not have to deal with things like infant mortality, diabetes, hypertension, and all of the disparities that exist. When you look at our website, bhcckc.org, again, that's bhcckc.org, you will see a lot of the statistics as relates to African Americans being twice as likely to die from things like prostate cancer and breast cancer, being 2.5 times more likely to experience infant mortality in certain zip codes. The inequities are extremely deep, but when you talk to individuals, regular everyday individuals, and you share the statistics with them, a lot of the solutions are rooted in their own economic empowerment and not economic empowerment, economic mobility, and essentially education. So when we did a program with about 60 families. It was mostly young mothers for 6 months. And they came up with our advocacy agenda. It's a 10-point advocacy agenda of things that they wanted us to see from an advocacy lens. Our mission at the Black Healthcare Coalition is to address health inequities, and we do it through 3 ways: access to care, health promotion, and advocacy. So we asked them to come together and come up with our advocacy agenda from a state, local, and federal levels of what type of laws that needed to be changed. And when exposed to a lot of the research and theories of change, they really came up with things like we need to make sure more kids have access to our 529 plans. And so they did a whole series around ensuring that young people and families knew about saving for college. They talked a lot about the built environment, ensuring that there were healthy grocery stores and things of that nature. So when looking at some of those root causes is why I decided to join the school board, because a lot of them were rooted in education. And then subsequently, I joined the city council after serving on the public improvement advisory committee, which essentially is over about $4 million in every council district. We have 6 city council districts, and every district has 2 members that predominantly preside over $4 million of how it's going to spend for public improvement projects every year. And then there's over 400 million in the citywide PIAC that we all get together. Each council person has a designee, so that makes 12, 2 from each district, and then the mayor has the chair. And so in looking at how investment was made in the third district, was one of the critical drivers in addressing the built environment through PIAC, which again looks at, you know, sidewalks and park systems and a lot of other things that make our communities vibrant. And so from there, I decided to serve on the city council. So kind of what have I been working on for the last 2 years? I think it's went to sleep. Okay, there we go. So I've been on the city council. It'll August 1st, it will be 2 years. And want to talk a little bit about three things. And after each section, I would like to pause and have a dialogue and conversation about kind of what you think. Maybe there are some ideas that you have that the city can look into as it relates to equity, or just any questions about each of these sections. So equity, preservation, and sustainability. My very first 2 months of being on the city council, I worked on a resolution declaring racism as a public health crisis. Again, with the backdrop of me serving as executive director of the Black Healthcare Coalition, I knew that oftentimes how race plays out, it manifests itself into all of these public or these health inequities. So we were able to pass that 13-0, so it passed unanimously to say that looking at the historical factors and some of the current factors of why we have these health inequities and that are related to health, and begin to look at what do we do to address them from a race perspective. I introduced, and some of these I'm going to just kind of read what the resolution says, not the whole resolution, but 2 sentences or so, just so that you can kind of get an idea of some of the things that we did. So for employment and construction, I introduced a resolution that basically says to direct the city manager to develop and implement a monitoring process to require contractors to report the hiring and retention of residents who live in the city's 6 lowest life expectancy zip codes for construction contracts that exceed $1 million and for all other contracts that receive $400,000. So when you think about employment and construction contracts and me directing the city manager to start to monitor construction contracts that are $1 million or more and all other procurement contracts that are $400,000 or more in the 6 lowest life expectancy zip codes, kind of tell me kind of why you think that that might be important, or why do you think that that might be a good strategy? And you could just unmute yourself.
Remember to unmute yourself to be able to respond.
I think I can see how that would help immensely, because it would get jobs for people that are being overlooked.
Wonderful. Thank you, Mary Kay. And that's absolutely it. When we're looking at how city dollars are being spent, we want to make sure that those dollars are being spent for our entire city and not just portions. And so when we look at economic mobility for individuals that are in the lowest life expectancy zip codes, again, people are very concerned about their economic mobility and their own economic empowerment. So we're just monitoring, and the construction community kind of went a little haywire. They were like, oh my God, no, what is she doing? And we're monitoring, not to say you have to do it, but let's take a look at what you are doing. And then how do we work with companies that want to address this issue, not from a stick perspective, but from a carrot perspective, that now we have data to say all of these contracts, either we're doing really well and we think it's a problem and it's not, or there's some opportunities for us to do better. And so we just implemented this solution where we're able to start to monitor, and we're asking companies, again, from a good faith perspective, to say, hey, do you want to be in an exemplar company that says that you're willing to hire people from all parts of the city? And what can the city do to help you if you're having problems? Maybe it's transportation, maybe it's childcare, maybe it's individuals that don't have the soft skills to be successful on the job. Those are all programs that the city can help with to make sure people are ready and able to participate. So this is the,
Melissa,
go ahead.
um, so I'm thinking, but tell me if I maybe heard this right, that you would have a lot of people working in the communities where they are most affected. Is that correct? Or are you saying?
Yeah.
Yeah, I mean, like, why not? I mean, I think it's really important that people make a change in their own communities, and it doesn't make sense for people to be brought in from everybody else's and have people in the community walking by who have these needs. Is that correct?
Absolutely.
Okay.
You absolutely right. And so it is important that when you look at construction sites, you are seeing a reflection of the people who live in the community, a reflection of all of our diversity. And so we will see, we do have one company, I don't want to put them on Front Street, but we do have one company who is very excited about this and excited about being an exemplar and developing a pathway for other companies to join on. Because we know that the greatest challenge, I believe that if I was to poll each of you, probably 80%, if I said, what's our most difficult challenge as a city that you see? A lot of people feel like, preventing violence and making sure that we are a safe city is one of their highest priorities, which are directly connected to individuals' ability to be gainfully employed, fully employed. And so a lot of what I see as a theory of change for the third district is really about economic mobility and economic development. So speaking of economic development and reform, I want to talk about that a little bit. And a lot of people say, well, the city has no jurisdiction over the school district. And that is right. Our city has, our Kansas City has 14 school districts. Each of them have their own school boards. But I believe that the biggest contribution that the city can make is to have economic development reform and not giving the children, our school districts, revenue away to large developers without any thought of how it's going to impact our school district. So this is, I think, Jan Parks, one of her most treasured topics when we talk about economic development reform. And essentially, I led an effort to make sure that the city had priorities as it relates to how we were going to spend our precious economic development funds. So essentially, these are tax breaks. They're not like dollars that we're giving developers, but these are taxes that they don't have to pay on the property that they would have had to pay, in which most of them go to our school district. They have the lion's share, as you all know, in paying property taxes, that most of our dollars, when we pay them, go to the school district. But the city gets to establish if we want to give incentives to those developers so that they don't have to pay those property taxes. And so my effort was really about, how do we have a kind of level set to say, okay, with all of these different incentives that are available, let's just make them more uniformed, and so that they go in knowing, okay, you get 10 years of a tax abatement, and then the tax abatement begins to go down from there. And we have priorities, so you can get more of a tax abatement if you address the city's priorities, which include the red line areas or historically disinvested neighborhoods. It includes historic preservation, which we had a really lengthy debate last week at the city council regarding historic preservation of properties. It includes developments that increase our jobs, and it increases our ability to get to those jobs. So just not a company that's coming in and having 50 jobs that's, that people can't get to, but jobs that have transit that come along with it. So really looking at what are the city's priorities, and then let's incentivize development for those priorities. And then finally, and then I'll pause for some question and dialogue, is during COVID, we knew that some of our areas were being impacted differently than others. And so I introduced a measure to look at funding based on zip codes and based on those lower life expectancy zip codes, and saying, okay, if we need vaccinations or testing for COVID, let's make sure that we are impacting those who have the least amount of accessibility to the testing and the vaccination, and also ensuring that everyone has access, because equity is not about giving someone something that someone else doesn't have. It's more about, if this group needs a little bit more because they're less, well off, or they don't have access to it, let's give them what they need versus giving the whole what they need. So everyone has what they need, right? And so I was able to get some zip code based funding based on equity that's traditionally not done. When we look at our city, we typically just divide by 6. We have 6 council districts. Let's just divide it by 6 and everybody just kind of go on their way. And so we were able to look at applying a lens of equity with that. So I will stop there and we could talk about equity or economic development. How do we address employment in the city?
Okay, I'll ask another question.
Okay.
Because at this very moment in time, COVID keeps cropping up, even though it is hopefully going away. And as I understand, the Black community still has low rates of vaccination. Is that correct?
Yes.
And why?
Yes.
And is that accessibility or what?
Yes. And so the African American community and the Latino community both have extreme disparities as it relates to COVID and the vaccination. Some of it has to do with trust for the medical system. Just imagine if you just never went to the doctor, just never, unless you were like deathly ill. There's just a huge, disconnect with a lot of African Americans, not all, and the medical delivery system. Trust is a factor, accessibility is a factor. I know that Reverend Modest Miles with the Morning Star Baptist Church, he probably gave out, in addition to Truman, he was probably neck and neck with Truman Medical Center in terms of giving out vaccinations. Just that small church gave out thousands of vaccinations. But you have, anti-vaxxers, people who just don't believe in modern medicine as it relates to protecting us from these illnesses. I was really pleased that our aging population, we didn't have to do a lot of convincing. Most of those who were 60 plus just went and got it, because I think, one of them talked about the polio shot and remembering when they couldn't, get to the swimming pools and things of that nature, and things began to open up after they got the shot for polio. And so that historical knowledge, I think, helped us out a great deal. But when you think about accessibility and barriers, the other thing, Ms. Kirk, is just looking at getting the vaccination on your terms, in terms of when you're available. If you have your a single mom and you have 2 jobs, like when are you going to be able to take off? All the vaccines were being
Mhm.
given mostly Monday through Friday, during regular working hours. And so people need to make sure that they're getting vaccinations on their terms. I was able to get some funding for Samuel Rogers Medical Clinic, where they're going to be doing vaccinations block by block. So literally similar to the election, like in terms of they're going to mail everyone on the block a little card saying we'll be on your block all week on the corner giving vaccinations. You can bring whomever you want with you. And they're going block by block in these areas where there's vaccine hesitancy to try to make sure that people have access. So I'm very excited about some of the non-traditional approaches that are happening. But yes, you're certainly right. There is a disconnect as it relates to African Americans getting the vaccination. There's a huge disparity there.
Well, thank you. And what I hear you saying, Melissa, coming from your point of view is, at another time in our history, we would have kind of ignored the fact that population wasn't being treated. And granted, it's a little selfish of some of us, wanting everybody to have vaccinations, but it's still a whole community that we have deemed as important. Even if so many of those people stay in their community, I'm so glad that we are making this, we're meeting them on their terms. And I think that's important.
I do too. And another experience that I've had, can you hear me okay?
Yes,
Another experience I've had is going, the grocery store I go to all the time. And most of the people that work in the store are African Americans. And I get to know them because they see me. And I remember asking one young woman just a few weeks ago, I said, have you been able to get the COVID vaccine? And she said, I want it, but no. She said, I can't get off work long enough to do that. And, and I don't have a car. So she said, I haven't. And then my other question to her was, it's been in my mind all the time. I had made the assumption that essential workers were on the list early to be able to get the vaccine. And I said to her, but you work here, you see all of us going, we're all going by you. You never know during COVID what we have or we don't have. And she said, no, nobody in this grocery store was considered essential. So that just kind of did me in. It's very
Yes, and we need to do a better job of going to the grocery stores with the van to vaccinate people. So
that's a good idea, yeah. But I just thought that should have been taken care of by the government.
Yes, ma'am.
Melissa, if I can piggyback on Mary's question, what can I as an individual do to help somebody like that I see on a daily basis at the grocery store or some other place that I frequent that can't get off long enough to get the vaccination? Is there anything that I can do about that?
Well, that is quite difficult. One of the things is we would love to show up with this van, so you can always, let us know where these places are. I know that we went to several grocery stores in the 3rd district, but to Mary Kay's point, there are one of the reasons why we knew that COVID was impacting African Americans and Hispanics more was because they make up more of the essential worker group. And so, to your point, my grandmother died of COVID, but she was in a nursing home, right? So she never got out, but it was the individual that was coming to her place the workers there that passed it on, right? And so we have to think about, to Mary Kay's point, it's like, how are we making sure that individuals that are the essential workforce, that are dealing with vulnerable populations, that are dealing with our elderly, that are in grocery stores, highly transmissible areas, get access to the vaccine on their terms, like pulling up in front of the grocery store and talking to the manager saying, hey, we're going to be here all day. If you can give people 10 or 15 extra minutes on their lunch break, we could try to get them, all vaccinated. But it does take that coordination to get that done. The other thing is, I'm pushing to make sure that these places are open on the weekends as well. So I'm on Truman Medical Center's board, and I've been saying, like, hey, we got to make sure that this stuff is open on the weekend so people can get to it. And so we're working on all of those things. So I would say, for them to call, for you to, tell them to call 404 CARE, and see if what they can do to make an appointment, to use their voice. Oftentimes, if you say to your employer, like, hey, I really want to get vaccinated, but that means instead of coming in at 10, I'm only going to be able to come in at 1. And I really do need to make up those hours that I missed because I don't need my check to be short. Mm-hmm. So, encouraging them to just use their voice in their agency to speak up and say, hey, this is life or death. And maybe not for you, but if you contract this and then give it to someone else that you love, that's going to make us feel pretty bad. And so, what can you do to speak up for yourself? But I'm certainly, send me all of the places. I will certainly forward them on to places like Samuel Rogers, who have these mobile vans to go and get people vaccinated. And we went, and I know Susan wants to get in here too, and this is your time. We don't have to get through all of this stuff we on the slide, but we went to the post office, and they said that they were going to be able to vaccinate like all of their employees, like 500 people. We got all the stuff, we got it all together, and probably only 100 people took advantage of it. So one of the things is educating people about the safety of the vaccine, and saying, look, I have the vaccine, wear a button, I'm vaccinated, or, talk to people about the fact that you are vaccinated and you're just fine. And so that's really critical, because people really are believing a lot of the falsehoods that are out there, that, it's going to make people not be able to have birth in the future. And I mean, just all kinds of things that are out there. So just sharing those stories with people. I'll say this last thing, Susan, I'm be quiet. I was we do a community baby shower, which I wanted to talk about a little bit later, but this weekend, and several of the women who came in did not have on masks, were pregnant and not vaccinated. So there's a lot of work we have to do. Okay, Susan, I'm going to be quiet.
Oh, I just want to say how thrilled we are to have you here. Spark is a Facebook page, and we have had you on there and and I keep seeing it just about every single day. So I know somebody else has got to see it besides me. I just think this has got to be, well, and besides the fact that you've gotten this recognition of being in the top 40 under 40, high five on that. You sound like you're the power of one.
Well, we need some more. So if anybody wants to come out and help us out.
A shining example of that. I just think this is a great time. I'm so impressed with Quentin Lucas, and I just think that has got to be uplifting, just to be there and listen to that. I also watch KCUR Week in Review, and I know the editor of The Call is on that. Is his name Kevin? Do you?
Eric Wesson.
Eric Wesson.
Wesson.
Thank you. I'm terrible on names, so forgive me.
No, that's fine.
What about letters to the editor and things for The Call newspaper in getting these vaccinations and so forth? Would that help much?
Yes, ma'am. And just really, just really working to get individuals who are trusted in the community to put letters to the editor. We have about 4 African American physicians that are on the BHCC board of directors. And so I'm always encouraging them to, let's put out information. These are people that see like hundreds and hundreds of individuals. Now, a lot of the folks that we're trying to reach, a lot of them don't have a personal relationship with physicians. But I believe if they see people that look like them that are saying, hey, it's okay, and by the way, I'm a doctor, we encourage you to get the vaccine. So the Black Healthcare Coalition, we've done a series called Is the Science Safe? Where on Saturday mornings we have physicians, the local health department director and others that come on, do a Facebook Live and just talk about where can people go to get the vaccine, talk about the science behind the vaccine, what actually happens when you get the vaccine, like what are those biological things that are happening. I remember one doctor we got on, he was from the East Coast, and he's like, I mean, it was appealing to the younger generation, I will say. But he said that, you know, when you get the vaccine, it's like your DNA is kind of replicating itself in terms of your cells to make sure that if the virus does attack your cells, then they have that heat for them when they get there. And so he utilized terminology to help people to understand like what was actually happening biologically, that it's not changing your DNA. It's, you know, really just helping us to fight the virus when it does come. So it's like a key that is being made to unlock, you know, your ability to fight off the virus. And so it was just very interesting to kind of get those different perspectives. Two-stepping, for example, is one of the things in the African American community that's very that is it's an enjoyable pastime. And so we were talking to a DJ, and it's like, okay, you're going to have to say yes to something, because he was a DJ and he does all these two-stepping parties and stuff. And so you're saying you're not going to get the COVID test and you're not going to get the vaccine and you're not going to wear a mask. Like, what is it that you're going to say yes to? And so finally, during that Facebook Live, he finally was like, okay, I'm going to get the vaccine. And we followed up and made sure that he got it. So I just think having those critical conversations with people and letting them know that they have agency over themselves. And it's not like you have to go do this, you're a horrible person, but here are the facts, here are the tools, and we hope that you make the decision that's going to help benefit the entire community. So, but yes, working with Quentin Lucas is, yeah, I enjoy working with him. He's very, very brilliant person.
He is so articulate.
And, yeah.
I love to listen to him, and sincere, and yeah, and getting off of COVID. I mean, if we could just do something about the gun violence in Kansas City and St. Louis. I just can't believe that we've got 2 cities in one state in the top 10 of the United States with murders.
Yeah. Yeah, violence prevention is a huge piece. So, which I want to talk about a little bit later. So,
Before we move on, Melissa, I saw that Wendy had her hand raised earlier.
okay,
Wendy, do
sorry.
you want to unmute?
Oh, I was just wondering which vaccines you're trying to give to the population.
So we're the Moderna and Pfizer.
So is there any way you can switch to all Pfizer? Because like the side effects on Moderna are so much worse. And these people, they can't afford to take more time off. And I know a lot of people with Moderna are getting sick for 2 or 3 days. And it just seems like since there's a glut of Pfizer and they're having to throw a lot out at CVS, is there any way to coordinate to get them the Pfizer vaccine, which has very few side effects and they're really mild?
Yeah, yeah, I will definitely, and I got the Pfizer one as well, and so I will definitely look into that. I appreciate you bringing that up because I think that that is a huge difference. Like I was talking to someone today who said that they got the Moderna and got very sick, and they were going to get their second shot. They were so afraid because they didn't want to
Right,
get sick
right.
again. And this is someone who had COVID and got very, very sick, and now she's getting the vaccination and got sick when she got the vaccine, and then she's getting her second shot tomorrow, and she's like, I really hope that I can pull it together to get the second shot because it was
Well, and
pretty
it's,
bad.
yes, and you know,
Um,
it's like they don't seem to advertise it, but if you go to the CDC website, if you just Google CDC locator, you may already know this, it like comes up with the
mhm,
vaccines that are available, and it has little boxes that are checked. If you
mhm,
uncheck the boxes you don't want, then you could just search for the Pfizer vaccine, and it'll tell you exactly who's got it and who
mm,
has open appointments for people that don't want to come to like the group situations. And that's how I got it at CVS. I've heard that
right,
some other places sometimes don't have
right.
it. Say they do, but CVS tends to have too much. And also, I was wondering, like, could you coordinate like giving out the vaccine at the two-step parties?
Right. Yes, ma'am. We don't know how it works with alcohol has been a really big thing where we haven't.
Oh,
We're like,
interesting.
oh, if people are going to be drinking, we don't want to
Ah,
give it out.
gotcha.
But yeah, so that's a really good idea. And the whole no wrong door, I think someone had asked about accessibility. And, when you go on a lot of those websites, and we have patient navigators at the Black Healthcare Coalition that will do a lot of those clicks for you. Like you call us and we'll try to kind of just tell you, okay, go to the CVS at this place at this time. We'll get you all registered because a lot of times people get frustrated when they're having to be rerouted over and over and over again, which I'm glad you brought up CVS and Walgreens because those are the places where they have operating hours after 5 and on the weekends. So thank you so much for bringing that up.
Well, I appreciate what you're doing.
Yeah, awesome. So I wanted to talk a little bit real quickly about preservation and so the city of Kansas City, I get them mixed up sometimes. So we're on the city really working on housing, blight remediation, and automatic bulky item pickup. So oftentimes in the third district, you'll drive around and you're like, oh my God, like, am I in a third world country? Like, all of the trash that's present, all of the high grass, like, is this Kansas City? So, really working on doing infill housing. So, owner occupied, single family housing. The third district is the only district in the city in which our census numbers has gone down. The census hasn't been certified yet, but the preliminary numbers that we have, we're seeing that the numbers of people who are choosing to live in the third district is going the wrong direction. So we have to make sure that there's quality housing. And I had introduced an affordable quality housing. So I introduced the measure that basically directs our Central City Economic Development sales tax to give preference for developers who are doing affordable housing. So if they're getting city money, that we can make sure that those dollars are going to units that people can actually afford. With blight remediation, we're looking at utilizing, I mentioned this $4 million that each district gets every year. When I started out speaking with you all this afternoon, I had talked about the PIAC, the Public Improvement Advisory Committee, and really looking at utilizing a portion of that to do widespread blight remediation, especially in those corridors that people have to travel as you're getting on and off of the highways. So like Emmanuel Cleaver Boulevard, Benton Boulevard, Paseo Boulevard, Linwood, 31st Street, 39th Street, those places that are in the 3rd district. Why don't we utilize some of the money to just make sure that the right of way, so the grass, that's the public part of the side of the sidewalk, not the owner occupied side, but the grass that's closest to the street is just automatically mowed and the trash is picked up. So really looking at how do we use city dollars to make sure that things are looking neat and clean as people are driving through the streets. And then I introduced something around automatic bulky item pickup. So in the 3rd district, it's a very, 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 very trashy place. I mean, there's just trash everywhere. And it's hard when you live next to a homeowner where, once a month, that there's going to be what we call a set out, where there's just a big, everything in the house is just sitting on the curb. And there's not a whole lot of places where you can go in the 3rd district in which you don't see this on multiple blocks. It does something to your psyche. It says, like, I'm not living in a clean, vibrant place. And so you decide that maybe you don't want to contribute to it being clean and vibrant. If you're just living in a place that's seen as the city dump. And so really, what I introduced was automatic bulky item pickup within a mile of each school, so that our children don't have to walk past all of the big bulky items that are mountains of trash, that we would, as a city, not require people to have to call in, but we would have a route where we would just make sure that around our schools that those places were clean. And so that passed as well. And so those are kind of some of the things that we're working on from a preservation standpoint. So, good. Any questions?
Melissa, you just mentioned the term set out, which I'd not heard, where everything is put out of the house. Is that due to evictions?
Yes.
And so, of course, that's a whole nother issue to be addressed. But that's the cause of the things being out there?
Yes.
Okay.
A lot of folks, we have a high mobility rate in the 3rd district as it relates to individuals who don't own the home. They're renting. 7 times out of 10 is from an out-of-town landlord. And there's a lot of evictions that happen in the 3rd district. And we even know that from a school district standpoint, which our mobility rate in the schools are very, very high. I think it was like 40% in which kids would have to move within the school year. Not all of that's related to eviction, but a lot of it is attributed to evictions. So home ownership is critical and key, which I'll talk more about what the Black Healthcare Coalition is doing about that a little bit later. So.
Ms. Robinson, this is Sherry Wilson. Wondering your thoughts on how you balance between the needs of code enforcement and non-punishment.
Sherry, can you start over? We didn't hear the beginning of your question.
Okay, I'll try again. I'm just wondering about your thoughts on how you balance code enforcement versus not punishing elderly homeowners who aren't able to make the corrections that need to be made. I spend considerable time in the 64130 zip code, and I always fussing about why don't they enforce the codes? And then I think it was Mr. Brooks who pointed out to me that a lot of those are people who cannot afford to do that and are not physically able to. And so how do you balance that?
I was just on a call the other day talking about that, and I just left Mr. Brooks. Actually, we were on a radio program together earlier today, so he's everywhere. But it is a challenging balancing act. I'm of the perspective that we should really focus our code enforcement on our out of town landlords or landlords that are quote unquote absentee landlords. If we just focused on those, then we would have much, I mean, like we only have so much bandwidth as a city in terms of code enforcement. And so we would be able to utilize our bandwidth in just focusing on addressing the absentee landlord properties. But the way that our system works, which I don't necessarily know that it's wrong, but it is challenging and it's hard to balance it, as your point, Ms. Templeton, in that our code enforcements are report based. So they only will come and see if there's an issue is if your neighbor or somebody calls and makes a report that there's a code issue related to your house.
No one does surveillance or anything then.
Yeah. No, it's no surveillance. It's all report based, where anybody can call and they, it's anonymous. And they can say this house has a problem, and then they have to go out and check the house and then they cite them for the things that they need to address. Now, two council members, Lee Barnes and Councilwoman Kennedy, she was the last term, they introduced a Love Thy Neighbor Fund. And so when the city gives tax incentives in some projects, then they put some money in what we call pilots, payments in lieu of taxes, into a pot to help elderly individuals address their codes enforcement issues and their code violations.
That's a good idea.
Yeah, and so the money runs out pretty quickly. We also have minor home repair. The city, we passed a $12.5 million housing trust. And so I'm going to be working very hard to make sure that the lion's share of that money just doesn't go to developers to build new things, but we are focusing on preservation and helping homeowners with their with things that they need to do around their homes to address some of the issues. The Central City Economic Development Sales Tax, which if you're a resident of the city of Kansas City, you voted on this 3 years ago. And that was a one city tax where it's 1/4 of a cent tax that helps the east side or the most disinvested census tracts.
Right.
In one neighborhood, the Santa Fe neighborhood was able to get, I don't know exactly how much, it was in $750,000 to $1 million just to address elders that are living in their homes and addressing things like their facades, their, siding, roofs, their windows, things like that to help them stay in their homes.
Right.
And so those dollars will be going directly to homeowners who, live in their homes and have lived there for at least a generation. So very excited about that.
Thank you very much.
Yes. And if you have any ideas ever, please, let me know.
Okay, thanks.
So the final thing that we wanted to talk about before we talk about more of the Black Healthcare Coalition is sustainability. So I have a community brain trust because one of the things was when I got elected to office, I tried to reach out to the people who were here before me. And it's like, how do you have some sustainability from one office to the next? So I developed the Community Brain Trust. These are 3rd District residents. They helped me come up with probably 60 to 70% of the legislation that I introduce or champion. So they're the Sherry Templetons of the community that are saying, hey, we have a problem. How do we fix this problem? And then helping to address those. And so we've done the automatic bulky item pickup piece came from something that they wanted to see done. Looking at mental health issues and making sure that the city's dollars are being spent appropriately through our health levy as it relates to mental health. They have a whole list of things that they come up with for a year, and they put it on a scorecard, and then they evaluate me at the end of the year as it relates to what I've been able to do or not do on the list that they came up with. So it's a really cool group of individuals who meet 6 times a year. Again, they come up with legislation, they come up with solutions, and they work to get those done. I passed something around monuments and memorials, and essentially, I wanted to read this one too. We requested the Board of Police, the Board of Parks and Recreation Commissioners to research, examine, and develop a comprehensive strategy for the removal of memorials and symbolic monuments, including streets, boulevards, and parkway names on city-owned property, together with property under the jurisdiction of the Board of Parks and Recreation, commissioners of figures that held slaves, promoted racism, or participated in the oppression of the dehumanization of others. And so really looking at the city-owned property from a sustainability perspective, like how do we get to racial reconciliation? And one of those things is to really come up with the comprehensive strategy on how we address city-owned property and how it impacts race relations in the city. We also passed 1% for violence prevention. So many of you all know, and I'm very excited about the new terminal at the airport, but the 1% for the arts allows for any public improvement in the city to have 1% of that public improvement budget be dedicated for the arts. And so we got a chance to look at all the beautiful art that's going to be in the terminal at the airport, and I'm very excited about that installation. And so we looked at from a sustainability perspective, like how do we do that from a violence prevention perspective? Can we look at the city's budget and say, okay, can we carve out 1% to address violence prevention? I would love to talk about policing because I know that that's a very hot topic, and I would love to have any dialogue or answer any questions that you have about that. But essentially, this was done well before the recent actions regarding how do we look at prevention out of the policing dollars. This is 1% out of the general fund, and the two actions, again, are wholly separate. One doesn't have anything to do with the other, with the what people are saying, how the city has segregated funds for policing. But this is, again, something wholly different. And we're looking at the general fund, making sure that 1% of the general fund would go to violence prevention. And I already mentioned from a sustainability perspective, the Central City Economic Development Sales Tax, CCED, the last bullet that's on the slide, that really has to do with the 1/4% tax. It generates about $10 million a year. And we really wanted to look at the area median income for housing for developers that were giving dollars to build housing. So giving preference to housing developers who are utilizing that $10 million for housing, making sure that the rates are the area median income and you're not displacing people out of their homes. When we talk about gentrification, I don't think gentrification is necessarily bad because it's really about building up a neighborhood to a middle class standard, and everyone wants to live at least in a middle class standard, right? There's nothing wrong with that. The issue becomes displacement when the neighborhood comes up and then other people have to leave because they can't afford to live in the new neighborhood. So with the area median income with the Central City Economic Development Sales Tax, we're saying, okay, please make these these housing units affordable for the people who live there now. So when gentrification happens, everybody gets to stay and enjoy the benefits of a middle class neighborhood. So any questions about sustainability or comments?
I have a comment about the monuments and memorials. Good news is I do know that there's going to be some Black suffragettes being, like statues being made. Have you heard anything about that?
No, I haven't.
American Association of University Women, they're working with the Parks and Rec to make that happen. So, you know,
That's awesome.
yeah, it is. I'll send you some information from AAUW.
Wonderful. Great. And there's these things with like 2 comments about like working with Parks and Rec and just what the assets that they have. Like when you think about Armour Boulevard, all the boulevards, all the parkways, they're maintained by Parks and Rec, which is a higher standard, right, of maintenance. Well, Armour Boulevard goes through our 4th district, but then when it gets to the 3rd district, it turns into 35th Street. And so really thinking about like how neighborhood planning and how things are set up that creates these uneven standards and these uneven situations. The last thing, and one of the driving factors of me joining the city council was around Brush Creek. Brush Creek starts in Johnson County.
Mm-hmm.
And it flows all the way through to the Blue River.
Mm-hmm.
Well, in Johnson County and when it flows through the plaza, there's a concrete dam. But then when you get into where African Americans were settled in Kansas City, a Brush Creek that's on the east side of Truth, it's a mud dam. And so all the trash collects because it doesn't have the confluence of moving the trash because of the way that the dam was created. And so in addressing some of those environmental issues, with PIAC, it's a $25 million fix.
Wow.
I told you earlier, we only get $4 million a year.
Wow.
So we had to advocate through Congress to get the funds to do a remediation at Brush Creek. And we were able to do that through the Corps engineers. It took a lot and I had to get on a plane, and Congressman Cleaver said, well, you could have just met with me in Kansas City. This was before I was on the city council. And I said, no, we need this fixed and we need to make sure that that we mean business, that we're not just coming by to, talk about whatever, like we need this to happen. And so we finally were able to get the money from the Corps engineers. It's in design now, but I wanted to make sure that the project got done. So that's another reason why I'm like kind of holding on.
Wow.
So that's really all, I'm an open book as it relates to any questions you have about serving on the city council.
Melissa, I have a couple comments. Judy Kirk again.
Okay, yes.
I love your presentation and the way you bring this all so close to home. We understand it well. And, I live off the concrete Brush Creek, but I totally see the problem, and I'm just thinking that shouldn't be that way. It's just called up the river. I should, I don't worry about that, but of course I should. So I'm really glad that that's being taken care of. That's so important. I also, like many of us, I drive down Troost and I drive, into the city, and I see, I don't want to say the problem of, but the situation of gentrification, where new homes are going up, new complexes, new, condominium buildings. And the residents are being priced out. And so how can we, so what were you saying we can do about that? How could we keep people there even though somebody's, they can't afford to live there anymore. They can't afford those prices. They can't afford their property taxes. What's the solution?
Yes. And this is something that does come close to home to me. My family has lived in Beacon Hill on 25th and Tracy for forever. And there's, $450,000 homes that are built up around my family home. And the taxes were, $300 a year, which was great. But now they're like $2,000 a year, and so a lot of people can't afford that big of a tax, hike. And so we have to start looking at utilizing more of the city's resources regarding freezing taxes for people. So if you do invest like $5,000 into your home, which a lot of people don't even have that, then you can get your taxes frozen so that you don't have to worry about those issues. I think that we're going to have to use the CCED, the Central City Economic Development Sales Tax, that $10 million smartly to kind of help people get those tax breaks. And then the other thing that is huge is that we shouldn't be giving incentives for developers who plan to price out the neighborhood. So if you want, these things don't really work financially if you don't have some subsidy from the city. The city has to say, you need to reserve units for individuals who can actually afford them. I introduced a resolution that says that if you receive city tax dollars, at least 20% of the units have to be affordable at different levels of affordability. And so I think that we need to be looking at that. The other final thing is inclusionary zoning. So that's something that a lot of cities have done across the country. We haven't done. It's an argument that Quentin Lucas and I have all the time around getting inclusionary zoning done, because what happens is if you're pricing people out of the neighborhood, you have to pull in resources from your development that will allow the city to build more affordable units. And so either you can build the affordable units yourself, or you have to pay for those affordable units to be built. And so we have to kind of get there to where we have if you're going to use, city resources, which land is a resource, then we have to make sure that everybody, especially those who are stalwarts, as we say, individuals that have been in the community, get to stay in the community. So there's a couple of city things that we're working on. And the last thing is really, I'm working on this piece, and hopefully Sparks, I'll tell Jan Parks about this, but a decade of healthy aging. The World Health Organization has launched the Decade of Healthy Aging, and I'm going to be doing a resolution to acknowledge the city as participating in this effort to make sure people can age in place. And that does mean economically age in place as well. But the city is going through a comprehensive study of our entire planning process. And we need to be thinking more about our aging population to make sure that more people can age at home. And so I look forward to doing that, not just for the 3rd district, but that's something that impacts our city as a whole. So hopefully she'll be able to, once we get it all up and going, she can share it with this group. And we would love for you all to send in a letter or to join a meeting by Zoom and to talk about the importance of building a city in which is inclusive, especially of those who are 60 and over. So.
I have a comment on that. I want an aging brain like Alvin Brooks. He doesn't miss much. And I mean, he can pull up dates from 60 years ago. I'm just in awe.
Yes, I named my second son after Alvin Brooks. His name is Brooks.
Oh,
So,
nice. Cool.
yes. I worked for him for many, many years at the Ad Group Against Crime. And so he's a dear, he's like a second father to me.
Oh,
So I would love a brain like him as well. Yes. He's a very, very healthy guy. So
Uh,
I know we have about, go ahead.
well, I just wanted to say I saw a interview with Taylor Himnus from KSHB and with Alvin Brooks, and it's about an hour long or maybe even longer. It is, you would probably really enjoy watching it if you haven't seen it.
Yeah, I don't think so. I don't think I've
So
seen it.
you have to look up Faith in Kansas City and then just click on the one with Alvin Brooks. Yeah, it was pretty
I
wonderful.
will do that. I will do that. Okay, I don't think okay, so I don't see Samantha who's logged on.
I'm here.
Oh, you're here. Wonderful. Okay. Hi, Samantha.
Hello.
Do you have your camera on?
Yes.
Okay. I hear you. I don't. Oh, there you go. I see you now. Okay, great. So I had to call in some backup, ladies and gentlemen. Samantha Fickrue. So I shared all about what it's like to be a city council person and a little bit about the Black Healthcare Coalition. We're addressing health inequities, and the 3 campaigns that we're working on right now have to do with infant mortality, access to care, and dementia. So with infant mortality, we have a 7-year program. So we start the moms when they're pregnant and the dads as well. And we keep them for 7 years. And so we do these community baby showers with them and really try to get baby to a healthy 1-year mark is our initial piece. But as we talked about before, really making sure that individuals have access to full employment. So making sure that they're fully trained by the end of the 7th year and they have full employment, that they're on the road to home ownership, if not a homeowner, and that their kid is in a school where they have a pipeline to K through 12. So really helping them with making good choices about schooling and things of that nature. It's a really wonderful program. We know that we can't just, deal with people from an episodic point, but really helping them over the life cycle. Access to care, which we talked about a lot when we talked about the vaccine. 2 things that we're critically concerned about. We do about 3,000 health screenings a year, biometric screenings, blood pressure, glucose, things of that nature. We make sure that everyone has a medical home, which means that they've gone to the doctor within a 12-month cycle, and we follow them to make sure that they keep those appointments and they have access to a payer source. So either we're helping them to enroll in insurance or get discounts from some of our area hospitals so that they have access to a doctor, not before they need them, and making sure that they're getting those preventive care. The other thing that we're focused on is dementia. Also in the African American community, African Americans are twice as likely to develop Alzheimer's, and then also twice as likely to find out about the disease, so that they're learning about it in later stages of the disease, which impacts their quality of life. So I wanted to introduce you all to one of my really good friends, Samantha Fickrue. She's with KU, and she's with the Alzheimer's Disease Center. And this is I wanted her to talk to you about BioH, which we're very excited about. It's something that everyone can participate in, not just African Americans. We at Black Healthcare Coalition, we help everyone. We just don't, focus on just one race of people, but we're also acknowledging the health inequities that exist, but we never turn anyone away for services or things that people need. And so I wanted her to talk about the BioH program and about kind of the exciting research that's going on with Alzheimer's. So Samantha Fickrue is a FNP, family nurse practitioner. Is that right? Did I get that right? Okay. And she's at KU. So go ahead.
Good afternoon, everybody. Is everybody able to hear me?
Yes. And
Okay.
did you have any slides or anything,
I
Samantha? I
do.
didn't know. Okay, so I'm
Okay.
going to stop sharing.
Okay.
And if you need help sharing, you let me know, Samantha. I've given you permission.
All right, great. Um,
And sorry, Samantha, I kind of talked over your time a little bit. My
oh, that's
apologies.
okay. Is it going to be a hard stop at 3? So, okay.
No, the beautiful
Oh,
thing
oh,
about this is we're recording it. So if somebody has to jump off, they'll be able to do
okay.
that and catch up later.
All right, well, I'll try to
Okay.
zip through my slides in 15, and then whoever can stay longer for some question answer, we can do that. All right. Uh-oh. All right. I hope everybody can see my screen.
Yep, we sure can. It looks lovely, Samantha.
Okay. Just over here clicking random buttons, but while I'm trying to get myself situated, here I'm going to stop sharing for just a second. Basically, what I wanted to talk about was just very briefly discuss like what is clinical research, what do we do here at the Alzheimer's Disease Center, very briefly talk about what's normal aging and what's not considered normal aging, and then the rest of the time talking about some studies that I'm really excited about, including the BioH study as well. So there are different types of clinical research. They're all pretty self-explanatory here. And these are all different types of research that we do at the KU Alzheimer's Disease Center. A lot of our studies focus though on treatment, prevention and diagnostic studies, and quality of life. The studies that I'm going to share more specifically with you all today are focused more on prevention and diagnostic, because I think, and you know, the thought here at the Alzheimer's Disease Center is to really cure Alzheimer's, you got to attack it before symptoms develop. So we got to be better at diagnosing Alzheimer's and treating people that are at increased risk. So what's a clinical trial? There are studies or treatments or strategies where we're studying those devices or treatments or strategies in humans. They can be very large, from hundreds of people, to pretty small. We study people that actually have the disease, or we study healthy people, and it may or may not include a placebo. I'm going to go through these next slides here pretty quick, just so that way we can get to the really important stuff. I don't know how much the audience is aware of different types of phases in clinical trials, but here at the ADC, we focus, or the majority of our clinical trials run from phase 2 to phase 4. And phase 2 is where we're studying people that have the disease in smaller numbers. Phase 3 is where we're ramping up to getting this treatment approved. And then phase 4 is after a drug or treatment is approved, and then we're comparing it to other treatments, and it's over a longer period of time, usually several years. Try this again one more time. Okay. There's several risks and benefits to participating in clinical trials. On the left-hand column, you'll see some of the benefits, and some of them are pretty obvious. Like you may have access or treatment to a new drug or a treatment before it's available to everyone. But I think some of the more important benefits more on the back end is that it gives you more, it helps you to become more involved in your own healthcare, and you have more access to having another set of eyes on you other than your clinician seeing you. And you're learning more about yourself and your condition, and being involved with people that have that same condition. And of course, there's that altruistic benefit where you know that you're helping other people in the future. And then of course there are some side effects. Most of these treatments are very safe. We're able to pretty accurately know risks for developing side effects by participating in clinical trials, and then being able to reduce it. The treatment, however, it may or may not be better than the current standard of care. That's why you're in research, is to see if we can find the best treatments that are available. And then with a lot of studies, you don't know whether or not you're in a treatment group or not. And then when you're involved in research, there can be some inconvenience to you. Usually research visits are a little bit more involved than just going for a regular doctor's appointment. There's a lot of standardized testing that has to be done at each appointment, which may seem a little bit redundant, but it's very important to be able to make sure that we're doing things the same way for everybody, so that way we're getting the most accurate results. And then I also wanted to talk just a little bit about how is your safety protected. And that's very important, especially as we're, really trying to work to improve access to research and participation for research participants from underrepresented groups. We really work hard to build trust and build relationships with underrepresented groups by not just showing up and asking them for help, but really finding out what these communities need, not just what we think that they need, and trying to help them in different areas of health. So ways that we can ensure safety is with our institutional review boards, and also with our data and safety monitoring committees. They're the ones that are making sure that keeping track of any side effects, seeing if this treatment is actually helpful or not. And even in the middle of the study, if they are finding that a study is causing harm, or it doesn't seem like it's effective, they're stopping it right away. And another important aspect, of course, is the informed consent before you even start in that research study. That's the part where everything is disclosed to you, what tests, what treatments you might be exposed to, the risks and the benefits. And that's your time as a potential participant to ask all the questions that you can think of. Now let's talk about what's normal aging versus dementia. So there are some mild changes in cognition that are considered a normal part of aging. And those changes, they're usually more subtle and affect like your processing speed and attention. So the most common things that I hear from older folks with normal cognition is, oh, it takes me longer to come up with the name of such and such or this movie, or I find that it's happening a little bit more that I go into the room and it takes me a few more seconds longer than normal to remember why I went into the room. Those things in and of themselves, that's usually something not to worry about. However, dementia, including Alzheimer's disease, which is the most common type of dementia, is not a part of normal aging. Symptoms, they can vary from person to person. So it is important to determine whether these changes are a significant decline in that individual or within normal expectation, because what's normal for one person might not be entirely normal for somebody else. And then here's some of the more common signs of Alzheimer's. We don't have time to go over all of them, but I'll just kind of highlight some of the ones that might not typically come to mind for signs to be concerning of Alzheimer's. And those are things like social withdrawal, more signs of depression or anxiety and changes in behavior and mood, struggling to communicate, and exhibiting poor judgment. And also another big one that's usually a red flag is difficult to complete very familiar tasks to that person. And I wish I could spend more time going over it, but we got to move on. Now I'm going to share a little bit about how Alzheimer's disease is diagnosed. It's usually within a different combination of what I'm going to briefly describe below. We actually get a lot of information from our families and our patient by actually speaking with them about how their memory, thinking, their day-to-day functional status, and behavior changes have occurred over time. We do different types of cognitive tests, like even the tests that you might get done at your annual wellness visit at your primary doctor, like the MMSE or mini mental status. We might also order more detailed cognitive testing that looks more into mood and behaviors, as well as more extensive memory testing. We might include some brain imaging like a PET scan or an MRI. And then we commonly check for lab tests to make sure that there's no other underlying common medical issues that could contribute to memory loss. And some common things are unrecognized thyroid disease or having a vitamin B12 deficiency. And usually those two tests should be, or it can easily be done by the primary care doctor, but if they're not already done, that might be that as well as maybe some other more specialized blood tests that we might order. So as Melissa had mentioned before, why is it important to know about, being at risk for having Alzheimer's disease or any type of dementia? The earlier we can determine it helps us, it's easier to be able to rule out other disorders like I just mentioned that can cause memory issues. And we can more accurately treat the condition and alleviate impact on the person and relatives and really do it in a more personalized approach. And then I think one of the most important pieces is being able to plan for the future of the person and the family, to get affairs in order, to look into long-term care options for what works best for the person and for the family that's involved in their care. So now I'm going to move into why I participate specifically in Alzheimer's disease clinical research. It's helping us to gain meaningful insight into the causes of Alzheimer's, because we think that we know what causes Alzheimer's, but there's lots of things that can confound and affect and contribute to Alzheimer's disease as well. And we also want to ensure that prevention strategies, like I mentioned, interventions and treatments are relevant to you, especially if you're in a part of an underrepresented group. I'm very briefly just going to go over some of the more common tests that we do in Alzheimer's disease. And I might have to skip a few slides so that way we can talk about these two studies that I'm really excited about. So we use different types of brain imaging and research, also in clinical care as well. But a special test that we do that's pretty much only available on the research side, that's not available so much in clinical care because insurance doesn't cover it and it's quite expensive, is an amyloid PET scan. And that's actually used to visualize the amyloid plaque deposits in the brain. And the leading theory in what causes Alzheimer's disease is amyloid plaques that build up in the brain that slow down conduction between the brain cells and cause atrophy or shrinkage of brain structures. So we can actually visualize that on an amyloid PET scan. An FDG PET scan looks at how the brain's functioning by how it metabolizes glucose. And that is actually a test that we use in research, but we also use it fairly commonly in clinical care as well, especially for like our younger patients, or if we're trying to determine different types of dementia. I'll skip over that. We also do quite a bit of cognitive testing in research as well. So now I'm going to talk about some of our current research opportunities that I'm pretty excited about. So our IGNITE study, that's a prevention study, and it studies how exercise can improve brain health in older adults. And what's included is you get access to a trainer, free gym membership. You do have to commit to being able to exercise, I think up to, how many minutes is that? I forget the total, it's not on there, but I forget the total number of minutes per week. But you're either randomized into a stretching and toning group or 2 different aerobic exercise groups that are different in the amount of minutes per week. And it's a 12-month study. And it's seeing how that exercise could possibly improve brain health, improve blood flow to the brain. It includes brain scans like an MRI, the memory testing. There is some lab work involved, and fitness assessments. One of the cool things about IGNITE is that while here at the Alzheimer's Disease Center, you know, we've, even before I came along and some of my other colleagues that have come along that have worked with underrepresented groups, African American research participation has been pretty low. I'd say around 2 to 3% just across the board in all of our studies are people that identify as African American. But in the IGNITE study, we were able to get, I think, our highest percentage of African American participation, and I think that was 8%. And while that still is way too low, that it does show opportunity for improvement. So we've extended enrollment in IGNITE, and again, it's open to everybody. But for healthy adults that are interested in, that aren't already on a routine exercise plan, that are interested in exercise and improving brain health, if you or anybody that you know would be interested, please let us know. And at the end of my presentation, I have information on how you can contact our center. The next study that I wanted to highlight is through Global Alzheimer's Platform. It's the BioHermes study, and it compares the effectiveness of a blood draw to these more costly and difficult to access tests to diagnose Alzheimer's, like that PET scan that I was telling you about, the amyloid PET scan. The amyloid PET scan without insurance is easily cost between $5,000 to $10,000 out of pocket if somebody in the community wanted that test for themselves. And then, you know, since we use the amyloid PET scan in a lot of our research projects, that drives up our budget, or that eats up a lot of our budget, because we have to pay for these PET scans. So if this blood test can be as effective as the PET scan, and it's less invasive, why not use this PET scan more often, not only in research, but in clinical care as well. So the testing includes that PET scan, there's some blood work, a saliva swab, and some cognitive testing. And this is another study where we're really targeting outreach to African American and Latino communities. we have found that there might be some differences in the cutoffs for some of these blood draws that vary between these different ethnic groups. And that's why it makes it so vitally important to make sure that we have adequate representation from everybody to make sure that these tests are accurate for everybody. And I'm very happy that GAP, the Global Alzheimer's Platform, who is our sponsor, is committed to making sure that we reach our benchmarks for this outreach. They're going to keep the study open until we reach our goal. And most other sponsors won't do that, especially when it comes, or can't do that, especially when it comes to like trying to be more inclusive. So that I think is wonderful. And that makes me really proud to be a part of this study and to be the principal or the primary investigator on the study as well. I'm actually the first here at the Med Center, the first non-faculty, non-physician primary investigator on a study. And I'm just so thankful that the Alzheimer's Disease Center and the Med Center in general are putting that trust in me to be able to lead out on this study. And of course, I wouldn't be able to do it without all of the assistance of people that know better than me here at the Alzheimer's Disease Center and people like Melissa that are helping us to promote this study. So I'll give you a little bit more of the specifics on the BioHermes study. Here at our center, we're looking to enroll at least 60 people, 1,000 people across 10 sites in the country. It's for people age, I don't know if you can see on the flyers, from 60 to 85, from normal cognition to people that actually have some memory problems. And then they have to have a study partner that is able to participate as well. It consists of 3 visits. One visit for the informed consent intake blood draws. Excuse me, the second visit is where you get the amyloid PET scan. And then the third visit is where you come back and we disclose your results. And again, the reason that this is important is to find easier or less invasive, more cost-effective ways to accurately diagnose specifically Alzheimer's disease. And that can help speed up the pipeline it can help speed up the pipeline for more research projects and actually new drugs that are available. And at the end, after I get to the end of my slides, I'll talk about how this study might help with people getting access to the new drug that the FDA just approved called aducanumab. Of course, we have other studies at the Alzheimer's Disease Center. We have, like I said, observational studies. We have other exercise and lifestyle studies like diet studies. And then we have drug studies here at our center as well. And if you're interested in any type of study participation at the ADC, I'm sure that we can find a study that would work, that would fit well for you, or that would be a good fit. And then finally, this is how to get in touch with us here at our center. We're redoing our website at the KU ADC. One new project that's kind of all encompassing for all of our community facing outreach is called My Alliance for Brain Health. And that's honestly the best way to keep up with current research opportunities, caregiver support, lifestyle recommendations, and educational programs here at our center. You can sign up for a weekly communication that's tailored to the things that you're specifically interested in. And you can join, or you can sign up at kumc.edu/KUADC for more info. You can also email or call the number that is here on the bottom right. So we'd love to hear from you. If you have more questions, if you want to sign up for some of our programs, or if you're actually interested in learning more and maybe wanting to get screened for BioHermes or Ignite. You can call this 588-0555 number and ask to speak with the recruiter and then tell them specifically what you're interested in. So I will briefly go back to the BioHermes study and tie in how that can be helpful for getting access to this new drug. And then I guess for however long you want me to stay on, I can answer questions. About how much longer did you want to stay on?
Well, we definitely want individuals to be able to ask questions. I put the link for the My Alliance in the chat. It's the best
thank you,
email
Melissa.
that I get every week. And I'm not 60 yet, but I love this. It's so many resources that are there. So I would encourage you to sign up. You will not regret getting brain activities, webinars, just a lot of great stuff that's there. So I put the link in the chat for you. So
And I will include it in the email with the recording of today's session, so people will be able to go back and find it as well.
Okay, great.
Samantha, we'll just keep going until people no longer have questions. So
Okay, that's fine with me. I can stay on till, like 3:30, no problem.
okay, perfect.
So for, I don't know how many people have heard, but the FDA recently approved a new drug for the treatment of Alzheimer's disease specifically. It's the first new treatment in about 20 years. It is a once monthly infusion drug called aducanumab or Aduhelm. There has been some controversy about its approval and its overall effectiveness, which I won't get into too much detail. Maybe we can at further webinars or presentations get Dr. Burns or one of the big guns to speak more specifically about this new treatment. But with what I know about this new drug and from the meetings that we've had about this new drug is that it is promising. We don't want people to think that this is a cure for Alzheimer's. Unfortunately, we still aren't at a cure, but this is a treatment that can actually help clear amyloid out of the brain and can help perhaps further slow down progression of the disease. And it's definitely a good step closer to us finding a cure. The FDA approved this drug for people with Alzheimer's disease. They didn't specify how severe, even though in the clinical trials it was studied in people that have mild Alzheimer's disease. So most likely in clinical practice, it's going to be available for people with mild disease. Again, it's a once monthly drug that's given via infusion. To be eligible for this drug, you have to know what your amyloid status is, if you have amyloid in your brain or not. And right now there's two ways available to know if you have amyloid in your brain. One is that amyloid PET scan that we said is available, but insurance won't cover it, and it costs several $1,000s. So for most people, that's not attainable. The second way for knowing if you have amyloid in your brain is by undergoing a lumbar puncture or spinal tap. And that is done somewhat in clinical care. Insurance can cover it, even though there might be some out-of-pocket cost associated with it. The drug company is going to, we've heard, is going to pay for the cost of testing the cerebral spinal fluid in the lab, but insurance and the patient will have to cover the cost of actually getting the procedure done in whatever healthcare facility. So those are the two ways of knowing your amyloid status. So going back to BioHermes, if somebody's interested in participating in that drug that does have memory concerns that looks like it's caused by Alzheimer's disease, you already have that completed amyloid scan and the results, and we're able to disclose those results to that participant, and then they can go and share with their provider if they choose that, yes, I have amyloid in my brain. I may be interested in this new treatment for Alzheimer's disease, and then go from there to see if that's the right choice for them. So that participating in something like BioHermes is a big step towards being able to see if you're eligible or a good candidate for this treatment without out-of-pocket cost.
I have a question, Samantha.
Sure.
Kind of back to the research being done about exercise and how that may make a difference. I believe that was one that you said that in order to participate, the one thing that kind of stopped me from thinking about doing that was, I believe that you said you need to have a study partner that does it all with you.
Oh, not that they don't have to do everything with you. So they're not like going to the gym with you 3 times a week. But when you come in for your study visits, which for the Ignite and some of our exercise studies, Ignite lasts for a year. And I think that they need to come like at the beginning and at the end. And then the study like a study like BioHermes, they come at the beginning, so to go over the consents and for the intake portion. And then it's up to you or not if you want them to go to your the brain scan, even though they can't go in the room with you, but they can take you to the appointment. And then it's up to you if you want them to come for the feedback session.
Okay, thank you.
Thank you for clarifying that, because I'm sure maybe some other people had that same thought. And I'm glad that you brought that up, because I don't want you to think that your study partner has to be with you for every exercise session. It's just the study partner is there for us to ask questions about how you're doing.
Samantha, I have a question.
Sure.
I've kind of watched this from the beginning. It may have just been last summer that this was introduced. So I put it on my computer website, but I've not really followed it. As it was being introduced, I remember it was a doctor saying, you know, we are doing Alzheimer's, but we understand that there are other dementias that will also be considered. I have dementia in my family. My father had Lewy body. My sister went down with Pick's disease.
Wow.
Yeah, I watched them both, and I'm concerned about myself. But it may not be Alzheimer's. It may be one of those.
Right.
So does that mean that I wouldn't qualify for any of these studies?
Not necessarily, because we know, first off, that it's not uncommon for people to have one or more different types of dementia pathologies present at the same time.
Mm-hmm.
So for example, vascular dementia and Alzheimer's disease are actually fairly common together. Fortunately, diseases like Pick's disease or frontotemporal dementia aren't as common. We do have a FTD study here at our center. I don't know if that's something that you've heard of, but it's for people that are at risk or actually have the disease, where we're looking for a specific gene. And then there's an actual investigational drug. We don't have any studies right now specifically for Lewy body disease, which for everybody else, that's more of a Parkinson's type dementia. But you know, even if you don't have necessarily a very strong Alzheimer's family history, we would still encourage you to come in and get screened for any of like our prevention studies, whether they're exercise, lifestyle prevention, or even like our treatment prevention studies.
Okay.
Did that answer your question?
Yeah, so actually to take part in your study, you're not taking people who are terrifically healthy right now. We need to have some sort of diagnosis.
For which studies?
Oh, like you were talking about the exercise?
Oh, for most of our exercise studies, we're looking for healthy older adults.
That's what I thought you said.
Mhm.
Okay.
But for our exercise studies specifically, we're looking for healthy older adults, but we're not looking for healthy older adults that are already athletes, because you already are in great shape. There's not
Yeah.
what we're trying to do. We're looking specifically at aerobic activity and how like moving from more of a sedentary lifestyle to more active lifestyle, doing through aerobic exercise can improve brain health.
Okay.
And the BioH one, Samantha, that's for healthy adults as well, right?
That's for healthy older adults. It's for older adults, or even, older adults that might not be that healthy, but not an older adult that's like critically ill. You have to be able to make all of the appointments. It can be for older adults that don't have any memory problems, or older adults that have some memory problems. Likely not severe memory problems, because they won't be able to participate in the cognitive testing, and they might not be able to understand why we're putting them through the testing and putting them through the PET scan. So not severe or end stage dementia patients, but people with maybe mild memory problems to mild dementia is what we're looking for. And we have specific cutoffs that we have in place. But if you or another older adult that even if they have memory problems, you don't know how severe they are, but you think that they might benefit from participation in BioH, you can still call and we can give you more information and maybe bring in for a screening. We're looking to be activated for the BioHermes study in the next week or two. We just got like our budgets approved. We have all of our other approvals in place. There's just a few of the finishing touches that we have left to be ready to start enrolling for this study. We plan on enrolling for about a year. But like I said, the great thing with the sponsor is we're going to keep this study open until we meet our goals of recruitment. And we will allow everybody in the study that meets criteria, even though we are really focusing our recruitment towards underrepresented groups.
Right, but you want everyone to be able to participate.
Yes, of
which
course.
is why I wanted to make sure that this group had early access to this opportunity.
Yes.
And one of the things is I'm telling people and trying to recruit for BioH is that you're only enrolling, I read 60 people.
Our minimum is 60.
Minimum is 60.
Yes, we can go over.
Okay, which is good, but I try to tell people to act quickly.
Exactly.
Because this will present a great medical package, I believe, for anyone.
Yes.
That they could present to their doctor so that they have an image of their brain and they don't have to, there's no costs associated.
Yes, and we also can disclose how you did on some of the more basic cognitive testing. We're not able to give you all of that raw data, but we can share how you did on some of the cognitive testing, and we can share your results on the PET scan. And we're going to package it very nicely for you, like in a nice folder that you can hold on to for yourself and that you can share with your healthcare provider. And then another great thing is we're going to provide some resources that are available here at our center, or how to start that conversation if you want to start the conversation on next steps with your primary care provider, or if you have your own neurologist that you want to see.
Okay.
Samantha, if one of our participants is interested in reaching out, we have the website that
Yes.
Melissa shared with us. Is that phone number that Melissa shared also the phone number to contact you at the 913-588-0555?
Yes.
Okay.
And I believe it's option 1 to speak with our recruitment team.
Okay.
Okay. Wow.
Thank you, Samantha.
Oh,
Yes.
it's my pleasure. Thank you for inviting me.
Yeah, thank you. Thank you.
And
Thank
so
you.
one of my jobs is to get Samantha out there in the community. So if there's any other groups, your bridge club, your book club, she can take 15 minutes and join your group, because we want to make sure that everyone has access to these opportunities.
Yes, I'd be more than happy to.
Well, and Melissa, as you said that, I thought to myself, boy, we need to give Samantha more time in one of these Kansas City Gems series classes where she can really dive deep into this issue.
Yeah, good point.
And
Next time.
And she has a wonderful just overall presentation about dementia that is about 30 minutes long. So I apologize again for talking so much, but she'll come back.
I can come back. I'm more than happy to. And hopefully in person sometime in the future.
Yeah.
Great. And thank you again, Melissa.
Yes.
Anytime. It's been fun.
You've done a wonderful service you are doing a wonderful service for the community, Samantha.
Oh, thank you. And again, it's not just me, it's the wonderful team that I work with at the ADC, and also our community partners like Melissa and the Black Healthcare Coalition that makes these things happen.
Yeah, Melissa was wonderful. I could listen to her another 2 hours or talk to her.
Don't tell me that. Well, thank you all so very much for having us. Ms. Parks has all my information. If you need anything, please reach out. And Samantha, if you want to put your information in the chat, you're more than welcome to.
Okay, I can do that before we go.
Okay. This is good. Thank you.
Great.
Thank you.
Thank you. Bye-bye.
Who said that, Sherry? Yeah, join my alliance. I think I'm on it.
All right, I've got that captured now, and I will include it in the email with the recording of today's presentation. Thank you all so much for being here, and we will see you next time.
Okay, bye.